Too many alarms can be dangerous in high-pressure environments like the ICU. When medical monitors beep constantly, the sound begins to blend into the background noise of the unit. This sensory overload creates a hazardous environment where critical alerts might be missed among the chatter.
Alarm fatigue happens when frequent, non-actionable alarms cause staff to become psychologically desensitized. The brain stops processing these signals as urgent warnings, leading to significantly delayed response times. It is a cognitive adaptation to an overwhelming volume of repetitive auditory stimuli.
To combat this risk, nurses must always investigate alarms and never silence them without a physical patient assessment. Use clinical judgment to customize alarm limits based on specific patient needs while maintaining vigilance. Every alarm is a vital message from your patient that requires a response.